There is a massive movement happening within the longevity and aging landscape. It turns out there is much we can do to extend our lifespan and reverse the effects of aging. What we've been taught and led to believe about aging and human disease are now outdated and no longer accurate. That means it's time to change the current mainstream paradigm and have different kinds of conversations when it comes to our well-being. And it's time to recognize that we have the power within ourselves to dictate and drive our own health span and aging journey. Hi, I'm Suzaida Hippolito, host of Timeless Vitality, where we are redefining aging so we become truly timeless. In this interview today, we are going to dive into regenerative medicine and some of the science behind our human biology. Specifically, we're going to talk about stem cells. Now, what little I know about stem cells is that they have the ability to regenerate and become any cell in the body. However, as we get older, our body's ability to produce healthily functioning stem cells is greatly diminished and is linked to aging. Here's the good news. Stem cells are being used to heal the body and reverse the effects of aging and disease, and enabling people to live longer, happier, healthier lives. Now, we are so fortunate to have with us today a world-renowned expert in stem cells, Dr. Jeffrey Gross. Jeff is a top-rated, award-winning, and highly sought-after board-certified neurosurgeon. His specialty is in stem cells, regenerative and precision medicine. Let me say that again, regenerative and precision medicine, spinal biomechanics, longevity, and biohacking. And now he's written numerous articles, book chapters, and scientific publications where he bridges clinical medicine, neuroscience, biomedical optics, and regenerative stem cell medicine. Most recently, he's been asked to author textbooks, stem cell textbooks, and is writing an informational stem cell. Jeff also founded Spine and Recelebrate with offices in Las Vegas, Nevada, and Newport Beach, California. Did I get that right?
Right.
He's helped thousands of patients with neurosurgical problems and issues, and he treated 95% of those cases without actual surgery. Let's dive right into this, Jeff. Now, tell us, how were you able to successfully treat 95% of those cases without actual surgery?
Thank you, Suzaida, and it's an honor to participate and talk to you today. I think that as a surgeon, we learn in our training how to do the surgery, and we learn in our practice how not to do it, how only to use it when it's absolutely necessary as a last resort, unless there's some type of emergency. So it allowed me to focus on all of the other treatments that we could try first that were less risky, less invasive. Mm-hmm. And that actually was sort of the impetus for me adding the regenerative medicine, the stem cell medicine piece to the equation, because it's also non-surgical.
And for our audience, give us the basics, the basic 101 on what is regenerative medicine.
So this is tapping back into our own natural healing and creation ability. You think about it that we all started out as fertilized eggs and became embryos and fetuses before we were born. And the cells that were causing the formation of all the organs and tissues in our body and our limbs and our brain and everything came from cells that had this power to divide and create. And those are called stem cells because we stem from those cells. Well, the entirety of regenerative medicine is based upon once we're born and done growing, even tapping back into some of those banks of stored stem cells to help
Mm-hmm.
heal, to maintain, to regenerate, to rebuild, and to slow the aging process.
Got it. Now, what happens with stem cells that as we get older, our body loses the ability to produce healthy functioning ones? What happens there?
Well, the Earth is full of pro-inflammatory stresses to the
Mm,
human and to other animals. Those might include chemicals in our water, pesticides, poor nutrition, or food that is, we'll call it nutritionally less dense. It doesn't have enough protein, perhaps, or too much carbohydrates, which are inflammatory. We're also exposed to
mm,
things in our air, pollutants. We're exposed to
mm,
electromagnetic waves, fifth generation cell phone technology, things like that. So our cells have to fight against these pro-inflammatory or oxidative stresses, and in
mhm,
doing so, we are in a defense mode. Our cells are fighting that
mhm,
through production of antioxidants, production of pro-inflammatory proteins and things. And because those cells are in defense mode, our stem cells are in defense mode. And defense is through the
mm,
chronic inflammatory pathways. So the more of that defense, the more of those stresses, the less optimally our cells function, and therefore the faster they age.
mm. I really appreciate how you simplified that explanation and made it very understandable. At least I think it's simplified and understandable because you don't often hear about doctors, clinicians talking about the what you have just described as oxidative stress. And so it's fascinating to hear that all of that, even fifth generation cell towers, like has a detrimental effect on our cells,
True.
right? And now I want to go into your background. How did you come into now your background? I believe as a physician is so unique because you bridged clinical science with clinical medicine with neuroscience and biomedical optics and regenerative stem cell medicine. Now, tell us, like in layman's terms, what is all that bridging about, and why do you feel it's significant for our wellness?
Well, I think my own path, stems from my, inquisitiveness and nerdiness. I like to know all these different types of sciences. I studied various aspects of things, including, the optics, lasers, molecular biology, which is, the foundation for stem cell biology, and then even neural networks, which is currently called AI. And
Mm-hmm.
but years ago we
Mm.
called it neural networks because that's the pathway for the
Oh.
pattern recognition um, that matches kind of what our brains do. But I bring these to the table in my clinical practice to pursue cutting edge and newer ways to address things with less dependence on pharmaceuticals, less dependence on surgical implants and sort of large reconstructive surgeries. There's a role for these things for pharmaceuticals and surgeries, but we should diminish only to the absolutely necessary because there are so
Mm.
many surgeries that are done out in the world that aren't necessary, and the results aren't great because of it, and it gives surgery a bad name. But I think I bring these things to the table just out of my own curiosity, and
Mm-hmm.
hopefully not only to benefit my own curiosity but to benefit others by linking diverse sciences into something applicable and useful.
I love how you call it diverse sciences. Well, and clearly, the patients that you work with are experiencing the kinds of results they would not otherwise if they were following just conventional medicine. Can you share some of the more, maybe more rare or more extreme cases that you've worked with to give our audience an idea of how this stuff works in your practice?
Sure. So we see mostly people who are either trying to avoid a surgery like a spine surgery or a joint replacement, a knee replacement surgery. We
Hmm.
have some of our best benefits in that area, all the way through working with people with metabolic or organ problems, like slowly failing kidneys, maybe insulin resistance, and or autoimmune or other hyperinflammatory syndromes, and it comes down to how much
Mm-hmm.
inflammation someone has. So
Mm-hmm.
many diseases are based upon inflammation, like MS, cardiovascular disease, Alzheimer's disease has an inflammatory component.
Mm-hmm.
Even diabetes syndromes involve inflammation of some of the cells in the pancreas, what have you.
What
So
about
we,
cancer? Does cancer fall into that
cancer
as
has an
well?
inflammatory component. Many causes, not all causes, many causes of cancer, which is not one disease. It's many diseases.
Mm-hmm.
Many causes come from the oxidative stress and inflammatory burden in the body that affects the immune
Mm-hmm.
system ability to remove those circulating cancer cells. And the spread of cancer and the progression of cancer is has an inflammatory component. So we really need to manage our molecular inflammation, and
Mm-hmm.
that can be done through lifestyle changes, diet, supplements, sleep, breathing, so many what we call epigenetic factors. And then,
Mm-hmm.
if those are inadequate, we can use regenerative medicine to come full circle. And that's where we use these technologies that we have learned from nature.
Mm-hmm. Wow. Wow. So I love that you're talking about bringing in some of the technologies from nature. And when you say that, are you referring specifically to stem cells and what other modalities?
Yes, and when we talk about stem cells, we use that as a phrase really for regenerative medicine, which includes stem cells, but also might
Mm-hmm.
include a lower level treatment like platelet rich plasma or PRP, or even more modern version of regenerative medicine called nanoparticles or exosomes,
Mm-hmm.
which are
Mm-hmm.
extracellular small vesicles that come from stem cells.
Mm-hmm.
So there are other technologies that I currently don't endeavor, and that's gene editing and that kind of thing. That's coming, but that's not specifically regenerative medicine, but that
Mm-hmm.
certainly is cutting edge biotechnology.
Mm-hmm. And how do you integrate AI into your practice?
So in rare circumstances where we have a patient with a strange syndrome of symptoms that has seen many physicians and doesn't have an explanation. I mean, I love these cases, right? Because
The
I want to
complex
I want to
ones.
help someone. Yeah, complex. I want to find the solution no one else has found, and we do that often. Sometimes we'll tap into AI with the symptoms because AI is really a pattern recognizer. When you look at the
Mm,
ones that are available online, they're pattern recognizers. They are trained by repetition, by information, and it really tries to
mm,
recognize patterns. Now you might say, well, I want it to write me something, and it predicts the wording and the phrase based on what you might want based on patterns. So really it's a
mhm,
pattern recognizer. And really as doctors, we're pattern recognizers. You
mhm,
come in with a sore throat and a fever, we say, aha, you've got tonsillitis, right? That's the pattern. You might not, but most likely you do. The same thing can happen in complex syndromes where we put in the symptoms and some backgrounds into an AI, and we help use that. Now, we don't want AI to tell us to practice medicine. We want to use that information to see if it helps us. Maybe it'll flavor our research into the
mm,
literature. And we see rare things. And the problem is when you see the same stuff over and over again, sometimes you have to look under the rug and find
Mm.
the rare syndrome.
Mm-hmm. And when would be a time for someone who is who has been comfortable or what they only know is the practice of Western medicine? Like when would you suggest might be a good time, if there's even such a thing, to start considering other types of medicine, such as regenerative medicine?
Well, I think if someone is having a poor response to pills and things like that, and the
Mm-hmm.
disease process is continuing, and they're suffering from that disease process, whether it's eating away at their organs through inflammation or pain or dysfunction or metabolic problems where they can't lose weight,
Mm-hmm.
um, those would be one area. Secondly, if it's someone who wants to avoid, a big structural surgery like a knee replacement,
Mm-hmm.
or someone that's looking to biohack to optimize both physical and mental performance and looking for
Mm-hmm.
options, or someone who has high inflammation, whether it's genetically predisposed, maybe through rheumatoid arthritis
Mm-hmm.
and related syndromes,
Mm,
thyroid problems where the body attacks the thyroid, or other types of autoimmune, certain types of infections like Lyme's disease and COVID are known to cause significant lasting hyperinflammatory syndromes, and these can all be measured.
mm-hmm. Okay, you mentioned biohacking in this space, or in your response. Some of our audience is just becoming familiar with biohacking. Can you describe biohacking?
Sure, biohacking is using knowledge and tools or tech. In this case, it could be biotech and regenerative
Uh-huh.
medicine to leapfrog and jump ahead to get desired results. So that
Mm,
desired results could be feel good. It could be improve your personal record and running a 5K. It could be optimizing your brain performance to get more work done in less time, things like that.
mm-hmm. Got it. And how does your practice address biohacking specifically? Can you give some examples, some tangible examples?
Sure, we have people that come in here who want to prevent disease or
Hmm.
improve functioning, brain functioning. Maybe it's an attorney that's going into a trial and wants to have optimal brain function, you know,
Mm,
you know, things like that. Physical performance. We have athletes, professional athletes that have benefited from this. We use biohacking through wearable health tech, whether it's an Apple Watch or other monitoring devices, Aura rings, Whoop bands, people that want
mm,
to improve sleep because it's so important for health, things like
yeah.
this. So we break every aspect of inflammation and longevity and health down with a
Hmm.
person. We go through their history. We start tweaking and optimizing or hacking these things with
Hacking,
that
yeah.
person on a precise level, because everyone's different, and what is needed for one person it might be different for the next, so we customize it.
Okay, got it. Thank you for that. Now going back, you mentioned on a precise level. So there's we have now regenerative medicine and we have precision medicine. What's precision medicine?
Well, precision medicine is really individualizing and customizing a number of data, usually a large number of lab tests, health metrics, um, objective measures, and then subjective complaints or how you feel and what problems you have, and customizing that for the individual. So it could be
Mm,
supplements, how we supplement, how much we supplement. It could be adding regenerative medicine for that person or dealing with specific areas. It could be aversion or avoiding certain things like, oh, this person's been drinking tap water, and it turns out the tap water in that town's not very good. Things like that. And so we try to break
Mm-hmm.
it down and find it's like watching an episode of House over and over again.
Yeah. Wow. Wow. So you really look at the whole person and their lifestyle and what else is going on in their life in your practice. And that's
We
very
do.
different than Western medicine, right?
Well, we still practice some Western medicine. I mean, we still do that. I'm trained in that area, but I began to expand my mind about 6 years ago as enough patients urged me, and this has just
Mm,
blossomed. And Western medicine doesn't work because of the, we'll call it, mismanaged care, the money driven health insurance problematic care, where you really just don't have a lot of time often with your physician, or they
mhm,
say you can ask me one question or go over one problem today. That's the opposite of
mm,
holistic, right? That's
mhm,
monolistic. It's one problem.
mm,
You got to deal
mhm,
with all the problems and all the aspects of life, like medicine, was practiced 100 years ago.
mhm. And that's one of the things I love about you, Jeff, is you are patient centric. You are a voice for patients. You're a patient advocate. And can you tell us about some of the things you're doing? Because I know you've contributed, I think I read that you contributed over $100 million just in different types of patient care related to being a patient advocate and supporting patients. Tell us about that aspect of your life.
Well, I've been blessed and have done well, and I like to give back. So one way we do that is through quite a bit of pro bono uh, consultations and things like this. So this is an active part of my weekly
Mm-hmm.
existence in my practice, and we participate in a big veterans group that we do regenerative medicine for, and but not just veterans, others as well.
Mm-hmm. Mm-hmm. And now you're a board certified neurosurgeon. How did you end up branching out into treating all these other diseases that may or may not be related to being a neurosurgeon? Because typically you think neurosurgeon is
Right.
simply that, but yet you treat the full spectrum, it sounds like,
Yeah.
of
Yeah.
patient conditions.
No, you're completely right, and I give credit to my patients. I mean, although I've always, you know, considered the other aspects of someone's history and problems and medical existence when applying neurosurgery for many years. I had 95% or more of my patients. Some of them were treated with non-surgical means, and some of them still had problems, and those problems might be pain that did not fully respond to injections or medicines or therapies or time or what have you, and
Mhm.
and the only thing left on our menu would be surgery, and we'd talk about it.
Mm.
And most patients are smart to say, well, maybe I'm not ready for that, even though I still
Mhm.
hurt. What else do you have, doc? Do you have stem cells? Because everyone's heard of that for the most part. So you hear that enough times, and instead of going to, my annual spine neurosurgery conferences, which I still attend, of course, I said, I'm gonna go in different directions since I'm so inquisitive, and I started going to regenerative medicine and stem cell conferences and did the training and the reading and the
Mm.
research, and then looked at all the best practices in the world, since the United States is a bit slow to adopt these, and I put together protocols, and I had done it with the idea that it would be for my spine patients, but as it turns out,
Mhm.
it's blossomed into other joints and other disease
Mm.
processes, and uh,
Wow.
you know, the medical knowledge and hasn't been lost on me to address other types of issues. So even though I'm a trained
Mhm.
neurosurgeon and spine surgeon, um, I think that shouldn't limit me to only seeing people with those problems.
Yeah. Wow, that is incredible. I mean, you're really truly helping all sorts of people and with so many different types of diseases. Now, I want to go back to stem cell therapy. What the little that I also know about stem cell therapy is that people will spend thousands of dollars on stem cell injections. Now, tell us about that world of stem cell injections. And then they end up with really bad side effects. Why does that happen in that case? And what is this world of stem cell injections?
I've yet to meet a person who's gone somewhere and had stem cells and had side effects. But it is a wide variety of offerings in the world. The the places that are ahead are Asia and Europe and Central America.
Mm,
I mean, you have these clinics, in Panama and Colombia and Costa Rica, Mexico, and they've been doing stem cells longer than we have in the United States.
wow.
The But what we do know about the United States is the labs in the United States are regulated and are certified and compliant, and you're getting high quality tested screened cells. So and that wasn't meant to disparage other clinics in the world that I'm sure have quality standards, but we don't know them, and I don't know all of them. So I know of good reputations, I know of questionable reputations in the world, but most people benefit, and it will tell you they benefit sometimes significantly from stem cells. Um, here in the U.S., since I started this 5 or 6 years ago when exosomes became available, I tend to use stem cell derived exosomes instead of stem cells for a number of reasons. One
So what's the
is
difference? What's the difference?
the exosomes are much smaller particles that are produced by stem cells, and they signal your own cells when they're delivered to fight inflammation, to act in a more youthful, restorative, anti-inflammatory, regenerative way. It's like a little dose of youth. And if you think about it, a pregnant woman is usually found to have glowing skin and feels
Mhm.
good and is in good mood, except maybe her back hurts from carrying the baby. But um, a pregnant woman is getting a dose of these exosomes every day from her baby in her womb. She's getting
Mm,
regenerative medicine. Um,
mm,
the stem cells are bigger, 1,000 times bigger than an exosome, so they have trouble traveling through the placental membranes to the woman. But she's feeling great and getting this regenerative activity because of the exosomes. So exosomes are smaller and they probably travel into tissues, penetrate tissues better. They're also easier
mm,
to store and handle because they're not really live, and they're also less expensive. In the body, they cross into the blood through the blood-brain barrier also, so the brain can get them, the spine can get them. So I'm a fan of these as well. Plus, they don't have any; they're not cells, so they don't have cell surface markers of any significance. So even though stem cells really aren't rejected, exosomes, even more so, are really not rejectable. So I'm a big fan of these nanoparticles or exosomes derived from stem cells because really stem cells are the
mm,
delivery method anyway. Uh,
mm,
so so that is really what we're using.
mhm. And where do the substances come from?
So these regenerative biologics come from FDA certified labs here in the U.S. And they are from screened C-section donors. So mothers delivering their baby by C-section instead of
Mm,
throwing away the afterbirth, the placenta, the umbilical cord, the amniotic fluid. It's collected
mhm.
and sent to a lab where it's tested, screened, and processed and frozen. And that's the process.
Is that the same as embryonic stem cells, or is
Not at
that
all.
different?
Not at all.
Okay.
Embryonic stem cells are much more powerful and not yet fully, we don't fully know how to control them. The stem
Mm-hmm.
cell and the stem cell derived exosomes that we use are from MSCs, mesenchymal stromal cells. So they can only develop into structural tissues of the body or organ tissues of the body. They can't go backwards and create something dangerous like a new person. You don't want to
Mm.
grow a new person within you.
Oh, fascinating, fascinating. So when in the exosome with that therapy, if you're when you're treating a patient specifically with that, the cells know exactly what to do when it goes into your body.
So the exosomes are give your cells information, and
Okay.
they're generic. They're taken up by probably all your cells, even your own stem cells.
Mhm.
And really, they
Okay.
seek to reactivate your own cell activity and your
Mhm.
own stem cell activity, and improve the efficiency and what we call cell metabolism and the
Mhm.
protein pathways that are being made in that cellular factory.
Mhm.
And they give information that tells which genes and which proteins should be active.
Mm. So they stimulate healthy communication in the neural network of the body. Is that one way to think about it?
Ideally, yes, cell to cell signaling. That's what it is.
Cell to cell signaling. There you go. That's a much more appropriate scientific term. Now, let's talk about longevity. What, how do you define longevity?
Well, simply put, longevity is measured in the calendar. How long someone lives, but we sort of use that term generically. Well, really, we're talking about health span, which is healthy longevity. Because if we have information and advice and things you can do to help you live 10 years longer than your parents lived, um,
Mm-hmm.
but you're in a nursing home for 9 of those 10 years, we
Mm.
may not have done you any favors because you'd be perhaps have a
Right.
poor quality of life during that time. We want people to extend their health and function and quality of life into that extra 10 years. That's a
Mm.
healthy longevity or health span, and
Mm-hmm.
that's what we seek to do here.
Mm-hmm. And what is your perspective with, because currently much of the world don't think about living, beyond 80, 90, 100 years old, even though as a species we're fully capable of that. What's your perspective on that?
I think we are capable of that and more, and we're seeing that especially in certain blue zones where people have had
Mm,
a life of anti-inflammatory diet and a life of anti-inflammatory
mm,
rest and social interaction and all this. Right? You look at the Mediterranean diet, you look at Okinawa, some of the other places, and it's what they eat and how they feel and how they interact and how they sleep and 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 the fats and oils in their diet, like the really extra virgin olive oils and the fish oils
mhm.
and all the bad fats we get here in the United States, all the vegetable oils we shouldn't be
Yeah.
having. So I think that we will continue to push the envelope both through simple lifestyle
Mm.
decisions and changes and supplements and even pharmaceuticals, as well as regenerative medicine, which can help your cells temper their smoldering inflammatory activities.
I love how you put that. It really is about the inflammation. I think I've heard this before many years ago, and I think now because I've been doing a lot of my own biohacking and getting to know experts in this longevity space such as you, that I've for myself, I feel like I really get it now when what you're talking about when you're talking about inflammation. And I hope that with our audience, they can begin to gain an understanding of that, because they truly have the ability to mitigate the effects of the inflammation. Do you agree, Jeff?
Uh-huh. Perfect. Yeah, you didn't need me as a guest today because you could have easily just yeah, you get it, and hopefully people will learn this. And listen, I had 4 years of med school and 7 years of residency. We did not study this. We did not study
Mm.
supplements. We did not study overall effect of inflammation, and and there were people that knew this. It just wasn't part of the curriculum. So I'm really glad that this brings me full circle, and now
Mhm.
reapplying my love and background for biochemistry and molecular cell biology to all these years of clinical medicine. So it's I get to tap back
Mhm.
into that. Love that.
Yeah, yeah, and I'm so grateful for the work that you're doing, and I hope your clinics get to grow, and it'd be
Thank you.
great to clone you or have people train under you, because I personally believe that this is the kind of attention and practice and care, like exactly what you've been giving your thousands of patients, that this is something that the world could greatly benefit from. And
Thank you. Thank you for that. Yeah, I agree. I agree with you, and I'm here to help educate and share with people that anti-aging medicine is a thing and regenerative medicine is a thing, and it's out there. It's not just something that you've heard about. You can have it.
mhm, mhm, absolutely. And with that, there's three questions, Jeff, that I ask all my speakers. And
Uh-oh.
the first, no, these are easy ones, they're good ones. The
Okay.
first question: what is your number one life hack for promoting your own longevity?
Well, I think intermittent feeding is probably one of the best things and easiest things you can do. Calorie restriction is known to promote longevity in all species. Um,
Wow.
so we are meant to respect the circadian rhythms biologically. So I don't eat in the dark very
Mm.
much.
Mm.
Um, so, some people call this intermittent fasting, but I think
Mm.
that's not accurate because we're not supposed to eat in the dark phase, in the sleep phase. So I call it intermittent feeding, which I didn't coin. Others have. So I try to eat within a 6 to 8 hour window and then be done.
Mm. Mhm. Got it. And what are some of the benefits that you know you've experienced from that that you can share with us? I'm curious.
Well, I think it helps control weight. My
Mm.
lab tests have been good during the
Mhm.
period. I've been doing this for years now. I have more energy. I think I sleep better when I'm fasted, and I know my
Mhm.
cells are doing their repair at night better when I'm fasted.
Mm. Mhm.
Um, and I like to think it's part of my longevity, biohacking longevity activities.
Got it. Now, next question is, where do you see the future of longevity headed?
I think it's going to be a combination of regenerative medicine, not just regular stem cells and stem cell derived exosomes, but designer exosomes, those that
Mm.
deliver more mitochondria to the tissues to help maintain muscle mass and bone density, both being known to be affiliated with longevity and reduction in disease. But I think you'll see new natural type pharmaceuticals like rapamycin and other medicines that are now used in the biohacking circles, including peptides, which are somewhat
Mm.
controversial now, only because someone says they are. But our body makes peptides all the time. Peptides are small protein fragments. So people have heard of Ozempic. Ozempic is a peptide.
Mhm.
You've heard of melatonin, it's a peptide. You've heard of Splenda, it's a peptide. So there are many different
Mm.
peptides out there, and some of them have health and longevity benefits to regulate gland tissues and other things. So I think
Mm.
we will learn more about that and apply it more strategically.
Mm. Fascinating. Looking forward to all of that. And the third question is, what thought or act takes you back to a childlike, playful state?
Well, let's see. I don't know what act. I mean, I tend to have a goofy sense of humor, and I love to laugh, and I think that laughing
Mm,
is a neurobiological necessity. It helps release happy hormones. So I'd
mhm.
say anything that's comedic, whether it's
Yeah.
stand-up comedy or something funny I've watched on the streaming channels or something that makes me laugh,
Mm-hmm.
takes me back to a happy childlike state.
Mm-hmm. Aw, awesome. Laughter. Laughter, that's what does it. I've asked Jeff to offer you all a free gift, and he created something nice for you guys. So, Jeff, can you tell our audience what is this gift?
Sure. Hopefully, most of you, if not all of you, are interested in some type of journey into longevity and health span. So, I have recorded I think it's about a half an hour get started on your journey masterclass on some
Mm,
things you can do without much fuss or effort. And we'll give you the link, Suzaida, and you can put it in the notes perhaps later. And,
yes.
and I look forward to making that available to everyone watching today.
Yes. Amazing. Thank you so much, Jeff. And
Sure.
any parting words for our audience?
Yes, additional bonus tip here for reducing inflammation is to move. Exercise
Mm,
stimulates the muscles to release myokines, which are signaling peptides that stimulate the brain, slow the development of
mm,
cognitive decline, support muscle and bone
mm,
uh, mass, which are all associated with longevity. So move, even if it's just walking
mm,
every day, move, move,
mm.
move.
Move, move, move. Amazing. I love this. And with that, cheers to longevity, regenerative medicine, and a happy, healthy lifespan. Thank you for being here with us, Jeff. I super appreciate your generosity and
My pleasure.
sharing so much of your expertise and your teachings.
Thank you so much.
Bye, everyone. See you all soon. Mwah.